Cranial nerves are 12 pairs of nerves that emerge directly from the brain rather than the spinal cord. They pass through various foramina in the skull to reach their target structures. Each cranial nerve is numbered I to 12 and named according to either its function or the structure it innervates. Functionally, cranial nerves can carry one or more of 6 possible components. These components are categorized based on whether they are motor or sensory, and whether they serve somatic or visceral structures. The 6 components are: 1 general somatic efferent, 2 general visceral efferent, 3 special visceral efferent, 4 general somatic afferent, 5 general visceral afferent, 6 special somatic afferent, 7 special visceral afferent. Let's explore each of these in detail. General somatic efferent fibers carry motor impulses to skeletal muscles derived from somites. These include the extraocular muscles and tongue muscles. The cranial nerves that carry these fibers are the oculomotor nerve, 3, trochlear nerve, 4, abducens nerve, 6, and hypoglossal nerve, 12. General visceral efferent fibers supply smooth muscle, cardiac muscle, and glands. These fibers are part of the autonomic nervous system and are primarily parasympathetic in cranial nerves. Cranial nerves that carry these fibers include the oculomotor nerve, 3, to the sphincter pupillae and ciliary muscle, the facial nerve, 7, to lacrimal and salivary glands, the glossopharyngeal nerve, 9, to the parotid gland, and the vagus nerve, X, to thoracic and abdominal viscera. Special visceral efferent fibers, also known as branchial efferent fibers, supply skeletal muscles derived from the pharyngeal, branchial, arches. These include muscles of mastication, facial expression, pharynx, larynx, and parts of the neck. Cranial nerves with these fibers are the trigeminal nerve, V, facial nerve, 7, glossopharyngeal nerve, 9, vagus nerve, X, and the cranial part of the accessory nerve, 11. General somatic afferent fibers transmit sensory inputs such as pain, touch, temperature, and proprioception from the skin and mucous membranes. These fibers are found in the trigeminal nerve, V, facial nerve, 7, glossopharyngeal nerve, 9, vagus nerve, X, and sometimes the accessory nerve, 11. General visceral afferent fibers carry sensory information from the viscera. These include signals from baroreceptors, chemoreceptors, and stretch receptors. The glossopharyngeal nerve, 9, and vagus nerve, X, carry these fibers. Special somatic afferent fibers are associated with the special senses of vision, hearing, and balance. These are found in the optic nerve, 2, and the vestibulocochlear nerve, 8. Special visceral afferent fibers carry the special senses of smell and taste. The olfactory nerve, I, carries smell. Taste fibers are carried by the facial nerve, 7, for the anterior 2/3 of the tongue, the glossopharyngeal nerve, 9, for the posterior 1/3, and the vagus nerve, X, for taste from the epiglottis and pharynx. To summarize the functional components of each cranial nerve. Cranial nerve I, the olfactory nerve, carries special visceral afferent fibers for smell. Cranial nerve 2, the optic nerve, carries special somatic afferent fibers for vision. Cranial nerve 3, the oculomotor nerve, carries general somatic efferent fibers to most extraocular muscles and general visceral efferent parasympathetic fibers to the sphincter pupillae and ciliary muscle. Cranial nerve 4, the trochlear nerve, carries general somatic efferent fibers to the superior oblique muscle. Cranial nerve V, the trigeminal nerve, has a mixed function. It carries general somatic afferent fibers from the face, scalp, oral and nasal cavities, and teeth, and special visceral efferent fibers to muscles of mastication and some smaller muscles. Cranial nerve 6, the abducens nerve, carries general somatic efferent fibers to the lateral rectus muscle. Cranial nerve 7, the facial nerve, carries special visceral efferent fibers to muscles of facial expression, general visceral efferent parasympathetic fibers to lacrimal and salivary glands, special visceral afferent fibers for taste from the anterior 2/3 of the tongue, and some general somatic afferent fibers from part of the external ear. Cranial nerve 8, the vestibulocochlear nerve, carries special somatic afferent fibers for hearing and balance. Cranial nerve 9, the glossopharyngeal nerve, carries special visceral efferent fibers to the stylopharyngis muscle, general visceral efferent parasympathetic fibers to the parotid gland, general visceral afferent fibers from the carotid body and sinus, special visceral afferent fibers for taste from the posterior 1/3 of the tongue, and general somatic afferent fibers from the pharynx and external ear. Cranial nerve X, the vagus nerve, carries special visceral efferent fibers to muscles of the pharynx, larynx, and soft palate, general visceral efferent parasympathetic fibers to thoracic and abdominal organs, general visceral afferent fibers from viscera, special visceral afferent fibers for taste from the epiglottis, and general somatic afferent fibers from the external ear and external auditory canal. Cranial nerve 11, the accessory nerve, has a cranial and spinal part. The cranial part joins the vagus and contributes to pharyngeal and laryngeal innervation. The spinal part carries general somatic efferent fibers to the sternocleidomastoid and trapezius muscles. Cranial nerve 12, the hypoglossal nerve, carries general somatic efferent fibers to all intrinsic and most extrinsic muscles of the tongue. Understanding these functional components is crucial for both neuroanatomy and clinical practice, as damage to a specific component will result in a predictable set of deficits. Identifying which components are involved helps localize lesions and diagnose neurological disorders.